A genetic disease is caused by changes or mutations in a person's DNA. Today I will be discussing what changes resulted in the people of Kentucky to exist with blue skin. After hearing briefly about the blue people of Kentucky, I immediately became interested in their story. Genetic diseases can cause many different physical changes throughout the body. A person could be born with webbed fingers or toes, or unusually shaped body parts such as the eyes. But I had never heard of such an unusual change like blue skin. This unique characteristic is what made me choose to conduct further research on the cause. What I discovered is the blue people of Kentucky suffered from what is called congenital methemoglobinemia. This is a blood disorder where an abnormal amount of methemoglobin is produced. In our red blood cells, we all have hemoglobin. This is a protein that carries air from our lungs to our organs and tissues by using its iron molecules to bind to the oxygen we breathe into our lungs. Methemoglobin is an oxidized form of hemoglobin. It is unable to bind oxygen, therefore it cannot carry oxygen to tissues. Since there is more methemoglobin produced in the blood of someone with methemoglobinemia, the hemoglobin is unable to effectively carry oxygen throughout the body. When there is a lack of oxygen, it will turn the blood a bluish color. Everyone has small amounts of methemoglobin in their blood, but we have an enzyme system located in our red blood cells called cytochrome B5 reductase that regulates this. It uses NADH as a reducing agent to donate electrons to an iron in the oxidation state. This then converts it to normal hemoglobin. This system helps to keep the level of methemoglobin in our blood very low. A genetic mutation found in the CYB5R3 gene caused an absence of cytochrome B5 reductase in the red blood cells of the blue people of Kentucky. This resulted in their methemoglobin levels range between 10 to 35% when the normal is supposed to be around 1%. Congenital methemoglobinemia is inherited in an autosomal recessive pattern. This means that two copies of the diseased allele or mutation are required for the individual to be susceptible to expressing the disease. In this case, for the blue people of Kentucky, Martin Fugate moved to Kentucky and married Elizabeth Smith. Neither showed visible traits, but just happened to be carriers of the diseased allele. They then reproduced, which gave their child a 25% chance to have the genetic disorder visibly passed on to him. Now, normally the chances of this disease continuing to be passed along is rare. However, the Fugate family lived in a remote area where they did not have the opportunity to interact with other people. This caused marriages to take place between family members. Because of this, the parents were more likely to have the mutation or to be a carrier, so the chances of children being born with a mutation increased. There are two different types of congenital methemoglobinemia. Type 1 is the most common, and that is what the blue people of Kentucky had. The most obvious physical symptom is bluish-colored skin that is caused by the lack of oxygen within the blood. A person can also show bluish-purplish lips, tongue, and nails. The most challenging part with this mutation is the mental well-being of the patients. Most people claim to be too embarrassed to be around other people, therefore affecting their mood and mentality. The life expectancy for most was well into their 80s or 90s. Type 2 is a less common and more severe case because it impacts both the red and white blood cells. This results in not just blue skin, but also severe neurological issues. Patients with type 2 are not expected to live past childhood. The chances of having this genetic disease is extremely rare. There have been cases found in many different ethnicities such as Caucasians, African Americans, Italians, Indians, Spanish, and Arabics. but that doesn't necessarily mean it can only be found in these ethnicities. The cases found in African Americans are rarer because of the already darkness of their skin color. In lighter skin colors, it is easy to notice the change to blue, but in African Americans, it is more challenging to detect. Because this disease is so rare, people would not expect their child to be born with this, so no testing has been done in the womb. After a child is born, blood testing can take place. The doctor will immediately be able to see if the blood shows to be a bluish, chocolatey brown color instead of red. The best way to diagnose, though, is testing through a multiple wavelength co-oximeter. This device measures the absorption of light passing through blood and is able to tell what percentage of the methemoglobin is found in the blood. There does not seem to be a permanent cure for this disease, but methylene blue injections have been used. This injection helps convert the methemoglobin to hemoglobin. This then reduces the blue-colored skin back to pink. However, this injection does not permanently last, and the blood will eventually turn back to blue. Because of this, many injections throughout a person's life will be needed. In summary, congenital methemoglobinemia is a rare condition caused by a cytochrome B5 reductase deficiency. This causes high levels of methemoglobin, which results in a lack of oxygen within the blood. This results in the blood and therefore skin turning blue. Cases that have recently been found could be detected after birth. A pulse oximetry screening was created for early detection of heart disease in infants, but doctors have now found that it can also be used to screen for high levels of methemoglobin. If high levels are noticed, patients are given methylene blue injections, which then lowers the levels of methemoglobin. It is found that eventually these levels will increase again, so measurements are constantly required to determine if more methylene blue should be administered. Patients are able to live semi-normal full lives except for the fact of living with a discoloration in their skin.